Hi, this is Dr. Manik Chopra. I am interventional cardiologist at Wokhart Hospital, Surat, and I am working in this hospital since last 4 years. I did my MBBS from Government Medical College, Surat, around 15 years back, and after that I did my MD General Medicine from the same college. I was working at various departments of cardiology, at different hospitals, and I entered DM cardiology in year 2008 and passed out in 2011. Since then I am working as an interventional cardiologist. Most of the times I was associated with Wokhart, and still I am associated with the same hospital. We at Wokhart do almost all the range of cardiology work, be it adult cardiology, be it pediatric cardiology, be it electrophysiology or peripheral interventions. But main work remains coronary interventions. They are the main work which we cater to. Coronary artery disease as such is a major problem which adult population faces in India, whether it is urban or rural. We get a lot of patients from the rural areas who are suffering from coronary artery disease, a lot of heart attacks coming from periphery, which come to our hospital for treatment. The present trend of the illnesses have been, seeing a complete drift from the spectrum of infective diseases and now coming back to the diseases related to lifestyle like coronary artery disease, obesity, strokes, dyslipidemias, diabetes, hypertension. They are all related to the lifestyle, and we are entering into basically the stage 3 of the epidemiology pattern of the diseases. We also deal with many of the non-interventional work like echocardiographies, treadmill tests, dobutamine echoes, stress echoes, and Holter examinations, which are needed on OPD basis evaluation of patients who visit us outdoor. We have a good outdoor department in which we have two echo machines which are portable, one fixed machine, 2 TMP machines, few Holters, and a good emergency with us and a good OPD setup, so which caters to the needs of OPD patients in and around the city. We also have some health checks mainly to diagnose coronary artery disease and cardiovascular diseases in adults. We also have few subspecialty people coming to our hospital in regard to pediatric cardiology and peripheral interventions also. We also do a lot of pediatric interventions, mainly PDAs and ASDs and VSDs. Regarding the peripheral interventions, we do subclavians, renals, iliacs, aortoiliacs, below-knee, SFAs, carotids. Though they are not so commonly encountered by us, but definitely we do whatever comes across to us. There are few specialists also which are just dealing with the peripheral interventions. They also come to our place. We also have a surgical peripheral vascular intervention team with us, and a lot of part-timers who are coming to our hospital who also subspecialize in these branches. Regarding the surgery part, we do almost all sorts of surgeries, pediatric surgeries, adult surgeries, in which main is coronary artery related bypass surgery, and we also do valve replacements, AVR, NVR, tricuspid valve repair, NV repair, and pediatric surgeries mainly ASDs, VSDs, PDAs, and tetralogy of Bellot. We have a full-fledged ICU which is exclusive for cardiac patients, and we maintain a strict decorum to keep the ICU as much as possible limited to the cardiac patients. We have a ward which is also dedicated to just cardiac patients, and we cater to need of cardiac patients exclusively, almost exclusively. We in recent times are doing complex PCIs, bifurcation PCIs, we are doing left main PCIs. We also do balloon angioplasty, coarctation of aorta. We have done quite a lot of complex PCIs, and a lot of primary PCIs come to our hospital. Few of peripheral interventions are also being done at our place regularly. Now there is a question regarding coronary artery disease. What all comes in that? Basically, it is a spectrum of diseases which varies from acute conditions to the chronic disease. Acute, and we get acute coronary syndromes, and chronic we get chronic coronary artery diseases. And they basically come to us almost regularly. We treat them with medicines and percutaneous interventions and surgeries. Medicines are basically antiplatelets, statins, beta blockers, ACE inhibitors, and interventions are mainly percutaneous coronary interventions. Surgeries are mainly coronary artery bypass surgeries. Regarding another question regarding the heartbeat, if the heartbeat is slow, then probably the patient needs a pacemaker. If it is high grade AV block, or if it is a complete heart block, then probably patient will need a pacemaker. There are different types of pacemakers available. One is VVI pacemaker, which is a single chamber pacemaker. And then we have a dual chamber pacemaker, that is MRI compatible, MRI incompatible. Both sorts of pacemakers are available. We also have the AICD, that is both single chamber as well as dual chamber available with us. Then there is another question regarding a problem of heart fast beat. Heart fast beats are probably of two types. One is which is completely irregular and persists throughout the day, which is also called as atrial fibrillation. And there are heartbeats, when they get irregular only occasionally, which are called as paroxysmal supraventricular tachycardias. So both have treatment. In paroxysmal supraventricular tachycardias, you will need a probably medical treatment, and if it doesn't respond to medical treatment, after say, if the episodes recur, or if you want a permanent solution to it, then electrophysiology, EP study and radiofrequency ablation is the solution to it. Regarding this question of pain in legs while walking, it can be due to problem of neurology, it can be intermittent claudication, it can be a neurological problem like lumbar canal stenosis, or it can be due to peripheral vascular disease, which is affecting the blood vessels of the lower limbs. It can start right from the infrarenal region and can go up to the iliacs, SFAs, and then probably below knee. So this is what we routinely deal with. Children can get coronary artery disease. It's a rarity. Children usually below the age of 14 or 15 do not get coronary artery disease. But with the change of lifestyle and with incidence of childhood obesity, and there are certain things like inherited dyslipidemias, inherited hypercholesterolemias. In those conditions, yes, you can have coronary artery disease even in children. The age of coronary artery disease has started decreasing. Earlier it was considered to be about 40, and now it has almost come down to around 20. So that is a definite shift in the pedigram, and that is mainly related to the lifestyle. But this childhood coronary artery disease is mainly because of dyslipidemias, which are hereditary and congenital. And if you have any other query, you can come to our hospital at Atwa Lane, Surat, or you can visit our web page or visit our website, so that we can be in touch. We'll be most happy to help you out in any way possible. We have a very friendly staff with us, which will take care of most of the things. Thank you.